We've discussed previously the processing of complete upper maxillary and mandibular denture, and all the assessment in terms of arrangement in class 1, class 2, and class 3 in a dentulous maxillary and mandibular arch. Now today the lecture will focus on single complete denture, whether it is either for maxillary arch or mandibular arch, and then whether they are opposing natural or restored teeth. Single complete denture is a complete denture that occlude against some or all of the natural teeth. A fixed restoration, or a previously constructed removed partial denture, or a complete denture, of course. Now, construction and delivery of single complete denture is more complicated than the delivery of upper maxillary and mandibular complete denture on the patient. There are four reasons that increase in the difficulties and the problems related, increased difficulties in processing the processing of such dentures. First of all, the ability of the patient to generate heavy occlusion force due to existence of opposing natural teeth, in terms of natural teeth or in terms of restored teeth. Then the unsuitability of the denture foundation tissue may cause it to resist high occlusal force from the opposing natural teeth, which results in advanced bone loss of the residual alveolar ridges. So we should expect later on relining for the complete denture. The super eruption of the opposing natural teeth produces an harmonious occlusal plane and minimize the vertical space for setting the opposing denture teeth. So we have probably limited spaces for the artificial teeth, so we need to deal with them. Mesial drifting, or as we say, migration of the opposing natural teeth and the adjacent teeth, and increasing the mesial axial angulation, the tilting where increased there is no burl at all, which produce an unharmonized occlusal plane. So the practitioner or the dentist may be able to overcome the problems associated with a single complete denture by applying many factors. First of all, all fundamental steps in denture construction must be followed and completed to perfection without minor error. Okay, now the occlusal plane of the natural teeth in the opposing arch must be harmonized. So that's mean probably we need a few modification. We'll discuss that later. Now, maximizing the ability of the denture supporting tissue to withstand destructive occlusal plane, the denture base border should have a maximum extension within the functional anatomic limits. In this way, the forces of occlusion will be distributed over the largest possible area of the denture supporting tissue. We have the causes and the occlusal problems and fracture of the denture bases. Generally, the occlusal stress on the maxillary denture and the underlying edentulous tissues from the opposing natural dentition probably lead to fracture the denture, while in the full complete upper and lower maxillary and mandibular denture, probably the load will be distributed evenly. So this may be reduce or limit the fracture of the denture in such a situation. The position of the mandibular teeth, which may not be probably aligned to achieve a bilateral balance for stability. This is one of the causes of the fracture as well, and problems in occlusion lead to fracture. Fracture of the denture base, and generally single complete denture may be opposed by one of the following: either natural teeth, or fixed restorations, or removable partial denture, or existing complete denture. So, according to such a situation, we have many steps or problems to overcome during construction of the complete denture. Now, the single complete denture opposing natural teeth, the most common complete denture is a complete upper denture and lower natural teeth. In eventually, of course, the evaluating of the natural dentition should be checked. First of all, we should have generally we have an even alignment of the teeth. There is a tipping, extrusion. We should put in our minds this with the natural teeth. The the character of the occlusal surface, the natural teeth often exhibit varying stiffness of the cusps and or associated abrasion and wear, of course. The cross-bite relationship, the number and position of the natural teeth may be due to many extractions between the teeth or the tilting, or the stability of the single upper denture during function is directly proportional to the number of the posterior teeth, of course. Now, complicating factors for the single mandibular complete denture opposing natural probably teeth, we have, for example, let me do that properly. Okay, now with the single complete denture, whether they are maxillary opposing natural or restored, or whether mandibular opposing natural maxillary, with the single mandibular complete denture opposing natural teeth, the denture supporting tissues for the mandibular complete denture is relatively small when compared to the maxillary supporting tissue. The mucosa and the submucosa overlying the periosteum and bone of the lower residual ridge is thin. For the above two reasons, the underlying bone is extremely prone to resorption from occlusal forces of the natural teeth. The solution for is to consider extraction the healthy upper teeth, since the long-term health of the mouth is at risk. That means if we have one or two teeth and we are planning the future to have a complete denture, so it is recommended to extract these teeth. Otherwise, probably we should stick to the options or the acceptance of the patient, of course. There are two situations where mandibular complete denture opposing upper natural teeth are accepted. One, when the patient has a class 3 jaw relationship. It's either edge to edge or severe or mild class 3. This occurs when the mandible is larger than normal or the maxilla is smaller than normal. And also when the patient has a cleft palate, either with the cleft partially open or closed. So these are probably accepted. The difficulty is found with the maxillary mandibular jaw relation for the single maxillary denture is the finalizing maxillary wax occlusal rim may not be parallel to the olatragus line, since the opposing occlusal surfaces of the mandible or the mandibular natural teeth will dictate the angulation of the occlusal plane. Now, the labiolingual thickness of the anterior wax occlusal rim will interfere with establishing the correct vertical dimension of occlusion. If the future anterior teeth arrangement will require vertical overlap. Now, the occlusal rim occlusion, with the occlusal rim occlusion, the anterior lingual portion of the maxillary anterior wax rim must be made thin. This in order to allow the lower incisors to produce the correct vertical overlap for establishing the correct vertical dimension of occlusion, which will be less than the vertical dimension of rest. We also have many occlusal modification and adjustment were needed in terms of adjacent or opposing natural teeth or restorations. With the mandibular natural, in term of opposing mandibular natural or restored teeth, they assess the occlusal plane. One method is to use an occlusal template in order to assess the relation of the occlusal surfaces of the teeth to the occlusal template. Now, the occlusal surfaces of the natural teeth can be ground or restored to give a more suitable occlusal plane, since in the future we probably have a full complete denture. Crossly malpositioned teeth can be considered for extraction or for orthodontic repositioning if the patient is young. Uh, Occlusal modification is best experimentally performed upon mounted diagnostic casts in order to determine the feasibility of the occlusal grinding or for restorations, of course. Now, the occlusal adjustment, perfecting the plane of the occlusion by two methods. These are, method number one is mount the maxillary edentulous cast and the mandibular cast on a semi-adjustable articulator using an arbitrary face bow and a centric relation record at the established vertical dimension of occlusion. Now then, make a protrusive record and set the horizontal condylar guidance, that means the condylar angle. Okay? Then we set the upper artificial teeth one by one on the denture base and adjust the lower occluding stone teeth by scraping in order to establish a harmonized occlusion plane. Mark the area of the stone teeth that have been altered. When a favorable occlusal plane and articulation of the teeth have been achieved, the occlusal adjustments are then carried out on the natural teeth in the mouth using the marked diagnostic cast and the trial denture setup as guides. After the occlusal adjustment has been made in the mouth, a new impression of the natural teeth is obtained, a new centric relation recorded is made, and the new lower cast is mounted on the semi-adjustable articulator. Now, the maxillary artificial teeth are then erased for harmonized in centric relation, occlusion, and in extrusive movement. The next clinical step is the trying of the trial wax up maxillary complete denture. This is the first method we can accomplish with the single complete denture, opposing natural restored. The second method is use an occlusal metal template. Again, the inferior surface of the template is slightly convex. The ideal occlusal plane is established when all the incisal edge of occlusal cast touches with metal occlusal plane, resulting in a slightly occlusal plane of the mandibular teeth. Now, the metal template is placed on the incisal and occlusal surfaces of the lower stone cast teeth. The cusps and incisal edges which are too high or too low are identified. Then the high stone cusps are reduced with sharp knife until there is an even contact of all teeth to the curved occlusal plane template. Now, reduces area on the stone teeth are marked on the cast by pencil, and the occlusal adjustments are then carried out on the natural teeth in the mouth using the pencil mark diagnostic cast as guide. All these steps should be modified in terms of construction a single complete denture which is acceptable in terms of occlusal plane and harmonizing perfectly. The quiz for the next week will be what are the causes of occlusal problems and fracture in the bases of single complete denture. This is what we have for today lecture. I'm planning to see you with the to discuss the next lecture for the next week. Take care and thank you very much.